Hi, I'm Dr. Kent DeLay, a board-certified urologist practicing in West Columbia, South Carolina. Today I want to talk about the different approaches or incisions that can be used to place a penile implant or a prosthesis. But first, what is a penile implant or prosthesis? A penile implant is a surgically implanted device which is used for the treatment of erectile dysfunction when oral medications, injections are not either effective or not preferred as the treatment of choice for ED any longer. This is a model of the penile implant. Briefly, there are two cylinders which go in the penis and create the erection, a pump which goes in between the testicles and the scrotum, and a reservoir which holds the fluid when the penis is not erect. It works by pumping the pump and transferring fluid into these cylinders, which creates an erection. When intercourse has been completed, a deflate button on the pump allows for the fluid to transfer out of the cylinders and for the penis to hang naturally again. So what are the different approaches or incisions that can be used to place a penile implant? The two most common would be an infrapubic incision and a penoscrotal incision. And a third device or approach which has been used recently is called a subcoronal, and we'll briefly mention that at the end. So an infrapubic incision means that the incision is made below the pubic ramus, or infra to the pubic ramus, and it is an incision which is above the penis. So this approach has a couple of advantages and disadvantages. The advantages are that because you're not making an incision on the scrotum, which can be a sensitive area which can swell, the pain and discomfort and swelling from the approach can be less than it is if you make the incision on the scrotum. The other advantages are that you're so close to the area where the reservoir is placed, you can often place it easier than you can if you make the incision on the scrotum. This incision is my preferred approach when a patient has a relatively low body mass index and isn't affected by obesity and doesn't have any complicating factors where there would be a lot of scar tissue in the penis. This approach isn't particularly good for complicated implants, but for a straightforward penile implant on a patient without significant obesity, I find it to be my preferred approach, as it allows for a quick recovery, I think less pain and swelling than a scrotal approach, and I use it quite frequently, and I would estimate about 70 to 80% of my overall penile implant volume. The second approach is a penoscrotal approach, and that means that the incision is made approximately where the penis meets the scrotum. This approach has several advantages and disadvantages, just like the infrapubic approach. The advantages are that you have great access to what we call the corporal bodies, or the cylinders where the penile implant is placed. So if there's a lot of scar tissue or other complicating factors which make the anatomy challenging, you have great exposure to all of it through this scrotal approach, while that access or exposure can be more limited to an infrapubic approach. So if I have a patient with a lot of scar tissue from either prior surgery or a priapism or something along those lines, I will often use a scrotal approach, knowing that if I get into trouble or have access issues getting the implant all the way to the end of the penis, I can use this approach and see all of the anatomy directly. So that is an advantage. Another advantage is, since you're in the scrotum, placing the pump is done under direct vision, and you can see exactly where it goes, while it is somewhat more of an indirect pump placement with an infrapubic incision. Now, I find that this approach does have a little bit more swelling and discomfort than an infrapubic approach, and can result in somewhat more wound issues and prolonged wound healing. Now, if a patient has a lot of obesity, sometimes maneuvering through an infrapubic approach can be challenging, and for that reason, if a patient has a significant amount of belly, for lack of a better word, I will often use a penoscrotal approach. The final approach that is worth mentioning is called a subcoronal, and this is where the incision is made through the patient's circumcision scar, or if they haven't been circumcised, you may perform a circumcision at the time of the implant placement and place the implant through this incision. Some have called this a natural scar approach, as it doesn't involve an incision anywhere except through the circumcision incision line. Now, this approach has some advantages in select circumstances. If I have a patient with Peyronie's disease and I know I'm going to need to do other things at the time of implant placement, such as grafting or application to straighten the penis, I may use this approach. The problem is, I find in my hands at least, I get a lot of tissue swelling and edema through this. I find that it takes a fairly long time for the incision to heal well. And if a patient has significant vascular issues because of atherosclerosis or because of a history of smoking or diabetes, I'm very reluctant to use this approach because I think it is more likely to have complications. That said, there are some who use it frequently, and I think in their hands they seem to do quite well. Now, the bottom line is there is no preferred or right approach on how to place a penile implant. I think the approach that is right for you is the approach that your experienced surgeon feels most comfortable with. So the most important thing is to find a surgeon with significant implant experience in placing penile prostheses. And if you have that surgeon, trust his or her judgment on how to place the implant. I hope this video was helpful in giving you a bit of an overview. If it was, please like and subscribe and turn on notifications so that you can see future content as it is released.